Welcome to lesson 1 of our Smart Family Best Practice series. In this session, we'll introduce you to the Smart Family method from Finland, a proven practical approach to support families in promoting healthy lifestyles for children aged 0 to 12. My name is Taina Sainio, and I work as a specialist in the Smart Family method at the Finnish Heart Association. Smart Family, what is it? It's a method that brings joy, motivation, and encouragement into everyday life of families. It helps families notice their strengths, build confidence, and support healthy habits in a positive and respectful way. We always start with the families and children themselves. Their everyday reality is the foundation of the Smart Family approach. Parenting and supporting healthy habits is not what it used to be. Food markets are overflowing with choices, finances are tight for many, and digital devices, often powered by addictive algorithms, demand our attention. All this happens while families try to juggle work, home life, and parenting. There are no quick fixes. Even though parents know what's healthy, making it happen isn't always easy. This reality is what we always try to keep in mind when developing and implementing the Smart Family approach. Health-related skills are learned at all ages and in all areas of everyday life. They are shaped in moments related to food, rest, body image, movement, and daily interactions. In the Smart Family approach, we focus on seeing the good, encouraging strengths, and building the idea that I'm valuable and worth taking care of. These small everyday experiences support a positive attitude toward health right from early childhood. The Smart Family method takes a comprehensive view of well-being, encompassing physical activity, nutrition, body image, and childhood overweight, rest, screen time, and family dynamics. By addressing health from multiple perspectives, it promotes sustainable long-term change rather than concentrating on a single aspect of well-being. Families are provided with practical ways to integrate health into their daily lives. The same thematic areas are addressed with both families and professionals. However, professionals are also equipped with a wide range of tools and materials to support their work. In 2024, our website in Finland was hugely popular. It was visited more than 380,000 time users, including both families and professionals. The Smart Family Method is a science to practice model that was launched in 2006, following the successful outcomes of the STRIP study in Finland. The Special Turku Coronary Risk Factor Intervention Project, STRIP study, is a long-term study aimed at preventing coronary heart disease through dietary intervention initiated in infancy and continued into early adulthood. The Smart Family method was inspired by the intervention model of the STRIP study. From the outset, our aim was to translate this scientific model into a practical approach that professionals working with children and families could use as part of their everyday work. We recognized early on that it would be not feasible to replicate the study's intensive format when aiming to reach all families across Finland. Therefore, we began implementation with public health nurses in maternity and child welfare clinics, professionals who have contact with nearly every family in the country. Today, Smart Family in Finland offers its healthy lifestyle counseling method to a wide range of professionals working with children aged 0 to 12 years and their families. We provide comprehensive training, tools and materials to support their work. Additionally, we offer families information and communication that is delivered with a positive and encouraging tone. Smart Family has been officially recognized as an EU best practice since 2021. Guidance from the healthcare sector alone is not sufficient to promote and sustain healthy lifestyles among children and families. No single professional group can achieve this alone. Smart Family is designed to be applicable across all professions working with families and children. In Finland, the method is currently evolving toward a more multi-professional approach. This kind of cooperation helps ensure timely, personalized support and makes real, lasting change possible for families. Families are always at the center. Around them, different professionals like nurses, teachers, social workers, and therapists play key roles. Each uses the Smart Family method in a way that fits their setting, whether it's a maternity clinic, school, or oral health care. It's important to recognize that this image reflects the context of Finnish professionals working with families. When adapting the Smart Family method to another country, it is essential to identify the relevant professionals who align with the local service structure and cultural contexts. What then is the essential core of the Smart Family method that makes it adaptable and transferable across different countries and professional contexts? At the core of the Smart Family method is a consistent evidence-based approach to working with children and families. This foundational principle applies across all professional fields, whether in healthcare or education or nutrition or any other context involving families. If there is one key message to remember from the Smart Family method, let it be this: focus on the positive. The most essential aspect is to recognize and strengthen the positives, to truly listen to the family's unique voice and situation, and to build upon the existing strengths of both the child and the family. The tools, materials, and everyday practices of the Smart Family method may vary depending on the professional context. For instance, healthcare and early childhood education. They are very different settings. However, the fundamental principle guiding how professionals engage with and support children and families remain consistent across all applications of the method. And here it is. This picture presents the central idea of the Smart Family approach, supporting the process of positive development within families. The process begins by encouraging families to observe their own everyday habits and health behaviors. The professional's role is not to instruct or advise from outside, but to walk alongside with the family by listening, asking open-ended questions, and helping them identify their own strengths, always within respect. When this happens, families begin to recognize what they already do well and what they are capable of. This builds self-efficacy, expressed in this mindset: we can, we know, we do. As a result, their motivation to maintain good habits and try new ones naturally increases. In turn, this supports an overall improvement uh, in the family's um, well-being. In short, Smart Family is not about quick advice or one-size-fits-all guidance. It's about creating a space where families can grow from their own strengths with professional support that respects their individual values and everyday life. By focusing on strengths and practical solutions, the Smart Family method effectively promotes healthy lifestyles in a sustainable and family-centered way. Training professionals and working together with them in co-creation is at the heart of success. Implementation must always be tailored to the local context. So when starting, it's important to identify the key professionals in your country, those who work directly with children and families. Begin with the pilot phase and make sure professionals are involved from the start. Select tools and materials that match the specific environment, whether it's maternity clinic, schools, daycare, or direct to families. Training is a key element to ensure that method is understood and applied consistently. And finally, remember, change takes time, not only for families, but also for professionals. Supporting them through that change is critical. In the Health for EU Kids Joint Action, we applied the implementation strategy originally tested in the CRODIS Plus Joint Action, which is explained in more detail in our presentation number two. One of the key outcomes of this process is the development of this framework, a more detailed task list to guide the implementation of the Smart Family method. This framework has been co-created together with the participating countries to ensure it fits various national contexts. Here I now present you the practical tools available for professionals using the Smart Family method. There are self-assessment tools for families and visual materials like posters, pictures and videos to support discussions, especially with children. For educational settings, there are food education resources and paper and pen activities to use directly with children. We've also created supportive materials for addressing sensitive topics like childhood overweight in a respectful way. All materials are available through a professional website that includes a resource bank and guidance for implementation. These tools help professionals apply the method in their everyday work effectively. In lifestyle counseling, self-assessment is a powerful starting point. It helps families recognize what they value, where they feel satisfied, and where they might want change. This is the Smart Family Card, a self-assessment tool to help families reflect on their eating and activity habits. Each habit is marked with a color. Green means it matches national recommendations. Yellow means it's partially aligned. Red means it differs or needs positive attention. The goal isn't to get all greens, but to spark reflection. What habits are we happy with? And what might we want to change? The card helps highlight strengths and open up positive, respectful discussions between professionals and families. This is another example of another kind of self-assessment tool. Star of Our Family is a visual self-assessment tool that helps families reflect on their everyday life together. Each family member rates topics like eating, resting, screen time, or doing things together. By connecting their scores into a star shape, they get a clear, non-judgmental view of their current situation. It's not about right or wrong, it's about understanding their own experience, which is key for motivation and change. It's also a positive visual way to start meaningful conversation in the family. For professionals, it's important to remember that the tools are not for evaluation or screening. But for example, in this STAR tool for a child's physical activity, a supportive way to identify the child's strengths and areas that might benefit from more encouragement and practice. These are examples of Smart Family picture tools. These illustrated food pictures support discussions about breakfast and snack choices. They help families and children explore a variety of options, fruits, veggies, grains, proteins and dairy, visually and positively. Instead of focusing on restriction, we focus on what can be included. These materials work well in counseling, group settings, or classrooms. They make it easy to talk about everyday meals in a concrete and encouraging way and support children's involvement too. We have a huge food education online service with tools and food education materials developed especially for early childhood education and school settings. There's a food education idea bank with games, playful exercises, and over 200 activity cards. A data bank for background knowledge with theory and methods for food education, and online course to support education skills as well. The materials are based on positive food education pedagogy, where learning about food happens through play, experience, and curiosity, not pressure or control. These tools help professionals integrate food education naturally into everyday routines. These are examples of our playful worksheets. They help children reflect on their daily habits in a positive way. They support self-expression and open conversation, great tools for engaging children and families in healthy routines. Our website and social media offers families easy access to tips, tools, and everyday inspiration. Everything is presented with a warm, encouraging tone, and professionals are encouraged to share and promote these resources in their work. Next, I will show you a few examples from the content of our web pages. Here you see examples of practical family-friendly articles available on our website. Topic range from picky eating and positive mealtime talk to nutrition during pregnancy. The content is easy to understand and designed to support families in real-life situations. These articles provide simple and encouraging tips for physical activity in daily life. Whether it's supporting children's motor skills, moving during pregnancy, or adding fun like circus play at home. All materials are designed to be encouraging, doable, and easy to apply. These articles support holistic family well-being, from dental care and emotional skills to smoke-free pregnancy and healthy routines. The goal is to empower families with practical everyday tools and encouragement. We also reach Finnish families through Instagram. Our posts share fun, encouraging, and creative content, like playful food ideas, positive parenting messages, and seasonal activities. Everything is designed to inspire small positive steps and changes in everyday life. To conclude, the heart of Smart Family is not just about using tools. It's about applying them with intention and warmth. Focus on the approach, highlight strengths, encourage small steps, and build trust. The tools support the process, but your interactions makes the impact. And remember, we are here to support you. Feel free to contact us. Thank you all for your participation. It's been a pleasure sharing the Smart Family approach and tools with you. Let's continue supporting families in everyday life, one small positive step at a time.